Hi, my name is Alicia Marks, and this is a video for Nursing 225 Medical Surgical Nursing 2 Lab as part of our online clinical experience. Today I will be teaching you about how to administer medications by either intravenous bolus or push through a medication or drug infusion lock. The goal of this is to be able to deliver medication via the IV route and have the patient experience the intended effect of the medication. First, you will want to gather up all of your equipment. You will check your medication order against the original order in the health record, according to your facility policy. You will clarify any inconsistencies. Next, you will check the patient's health record for allergies, check your drug resource to clarify whether your medication needs to be diluted before the bolus administration. You'll want to verify the recommended administration rate, know all of the actions, special nursing consideration, safe dosage ranges, purpose of administration, and adverse effects of the medications to be administered. Consider the appropriateness of the medication for this patient. Then perform hand hygiene. Then move your medication supply system to the outside of your patient's room or prepare your administration at your medication supply system in the designated medication area. Alternatively, you can assess the medication administration supply system at or inside your patient's room. Then you will unlock the medication supply system or your specific drawer, enter your passcode, and scan your employee identification if it is required. You always want to prepare your medications for one patient at a time. Next, you will read your electronic medical administration record and select the patient's proper medication from your medication supply system or your patient's medication drawer. Compare the label with the electronic medical administration record. Check your expiration dates and perform your calculations if it is required. Scan your barcode on the package if it is required. If indicated, withdraw your medication from an ampule or vial. Depending on your facility policy, the third check of your label may occur at this point. If so, when all of your medications for one of your patients have been prepared, recheck your label with your electronic medical administration record before taking your medications to the patient. However, many facilities you may be placed in require the third check to occur at the patient's bedside table. After you've identified the patient, lock your medication supply system before leaving it. Transport your medications and equipment to your patient's bedside with care and keep all of your medications in sight at all times. You'll need to ensure that your patient receives their medications at the right time. Next, ensure that you have performed hand hygiene and put on your personal protective equipment, if indicated. Identify your patient, then compare your information with your electronic medical administration record. Your patient should be identified using at least two of the following methods assigned by the Joint Commission. You'll want to either check the name on your patient's identification band, check your patient's identification number on your patient's identification band, check your patient's birth date on your patient's identification band, or ask your patient to state his or her name and birth date based upon your facility policy. At least two of these checks must occur before completing medication administration. Once both of your specific patient identification checks are complete, close the door to your patient's room or pull your patient's bedside curtain closed for privacy. Next, you will complete any necessary assessments before administering any medications. Check your patient's allergy bracelet or ask your patient about any known allergies. Explain that you are going to be administering medication to your patient and the action that your medication will have on your patient. Scan your patient's barcode on their identification band if it is indicated. Based on your facility policy, your third check of the label may happen at this point. If so, recheck your labels with your electronic medical record before you administer the medications to the patient. Next, you will need to assess your patient's IV site for any presence of inflammation or infiltration. You will then don clean gloves. You'll want to remove your passive disinfection cap from your needleless connector or access port of your medication lock. Alternatively, if you have your passive disinfection cap and it is not already in place, you will want to use an antimicrobial swab to vigorously scrub your needleless connector or your access port of your medication lock and allow it to dry. Uncap your saline flush syringe, stabilize your port with your non-dominant hand, and insert the saline flush syringe into the needleless connector or your end cap on your access port of your medication lock. Release your clamp on your extension tubing of your medication lock. Then pull back on your syringe plunger to aspirate your patient's catheter for positive blood return. If your patient's blood returns within the syringe and is positive, instill your solution over 1 minute or flush your line according to your facility policy. You'll need to simultaneously observe your patient's insertion site while inserting your saline. Then remove your syringe. Next, you will want to use antimicrobial swab to vigorously scrub your needleless connector or your end cap on your access port of your medication lock and allow it to dry. Next, uncap your medication syringe. Insert your medication syringe into your needleless connector or your end cap on your access port of your medication lock. Using your watch or clock in your patient's room with a second hand to time your rate of administration, inject your medication at the recommended rate. Do not force your injection if any resistance is felt at all. Whilst administering your medication, observe infusion site and assess your patient for any adverse reaction that could occur. If any signs of adverse reaction occur, stop your infusion immediately and notify your patient's primary health provider. You'll now want to remove the medication syringe from your access port. Use a new antimicrobial swab to vigorously scrub the needleless connector or end cap on your access port and allow it to dry. Then stabilize your port with your non-dominant hand, uncap your second saline flush syringe, insert your saline flush syringe into the needleless connector or end cap on your access port. Next, instill your flush solution at the same rate as the administered medication. Your medication lock is capped, your positive pressure valve or device. Remove your syringe and then clamp your extension tubing. Alternatively, to gain positive pressure, if your positive pressure valve or device is not present, clamp your extension tubing whilst flushing the last of the saline into your medication lock. Remove your syringe using your antimicrobial swab. Vigorously scrub your needleless connector or end cap on your access port of your medication lock and allow it to dry. Attach your passive disinfection cap to your needleless connector or end cap on the access port of the medication lock. Discard your syringe in the appropriate receptacle, doff your gloves, and any additional PPE if used. Next, perform hand hygiene. Begin documenting the administration of the medication immediately after administration, and then go in and evaluate your patient's response to the medication within an appropriate time frame. So this is how you administer medications by intravenous bolus or push through a medication or drug infusion lock. Thank you and have a good day.